Welcome to this explainer. Look, if you're living with severe chronic back pain, maybe you're struggling with a herniated disc, aggressive sciatica, or spinal stenosis, you know all too well how much it just steals from your daily life. And if you're living in Canada, you also know the painful reality of the current healthcare landscape. You aren't just fighting debilitating physical pain, you're actually fighting the calendar. So today, we're going to dive into the latest data on provincial waitlists, and more importantly, we're going to explore how patients are actively bypassing these backlogs to access advanced, non-fusion spine care right down in Arizona. Okay, let's jump right in.
Right off the bat, I want you to ask yourself a pretty heavy question. How much longer are you willing to put your life on hold for back surgery? When you lose your mobility, your entire world shrinks, doesn't it? You miss out on family events, your work suffers, and man, your mental health takes a massive hit. The sheer frustration of being told to simply wait while your body literally deteriorates is overwhelming. So let's look at the reality of the Canadian healthcare crisis and why that wait is prompting thousands of people to just take matters into their own hands.
Section 1. The Canadian Waitlist Crisis.
The sheer scale of this delay is honestly staggering. When we look at the referral to treatment wait times, the timeline is often measured in years, not months. In Alberta, for instance, patients are waiting anywhere from 48 to 61 weeks just to get through the system from a referral to actual surgical treatment. And in Manitoba, limited published data and patient reports show that wait times can actually exceed 2 whole years. Just think about that. 2 years of living in chronic progressive pain. This systemic bottleneck is exactly why an estimated 105,000 Canadians travel outside the country for medical treatments every single year.
But here's the thing. The alternative is immediate relief. On one hand, you've got the Canadian public wait, spanning months or even years, where patients often spend the bulk of that time just waiting for a specialist consultation. On the flip side, we see the rapid access available through private healthcare in Arizona, where access is measured in mere days or weeks. You aren't just placed at the bottom of a massive backlog, you are given priority access to care.
Section 2. The true cost of waiting.
Because waiting isn't just frustrating, it actually has a severe physical and economic toll. Research indicates that waiting 18 months or more for spine surgery introduces some really profound risks. We're talking about irreversible muscle atrophy as your mobility declines. You see a heavy reliance on pain medication, which carries its own set of dangerous side effects. There's the progression of the spinal disease itself, meaning the surgery you eventually do get might need to be way more complex than if it had been handled early. And finally, lost income. For example, if you're a self-employed individual waiting over a year for surgery, you can easily lose tens of thousands of dollars in missed work, which is often double the actual cost of just getting the private surgery.
Section 3. The Arizona Alternative and Elite Precision.
Now let's talk about Dr. T, who brings an incredibly rare pedigree to the operating room. He holds a dual fellowship. First, he completed a neurosurgical spine fellowship at the globally renowned Stanford University Medical Center. Then, he actually stacked that with an orthopedic spine fellowship at the Texas Back Institute, which is famous for pioneering motion preservation surgery. This combination is exceptionally rare. It basically means he has the micro-precision of a neurosurgeon combined with the structural expertise of an orthopedic surgeon.
And because of this hybrid expertise, Dr. T focuses entirely on master-level precision. While traditional systems might only offer you highly invasive open spine fusions, complete with metal screws and rods, Dr. T is dedicated to ultra-minimally invasive endoscopic alternatives. His goal is to fix the problem while preserving the natural movement and anatomy of your spine.
Section 4. Advanced non-fusion surgery explained.
So what does this actually feel like for you, the patient? That's what truly matters here. First off, peaceful sleep. The procedure is performed under general anesthesia, meaning you're completely asleep, resting comfortably, and entirely free of any pain or anxiety. Second, pinpoint precision. Instead of a massive open incision that just tears through muscle, Dr. T uses tiny, pencil-sized incisions and an HD camera to address the exact source of your pain. And third, ultimate safety, achieved through an amazing technology called real-time neuromonitoring.
Real-time neuromonitoring is essentially your ultimate safety net. While you're asleep, advanced computer systems are tracking your nerve pathways millisecond by millisecond. Remember Dr. T's elite neurosurgical training from Stanford? Well, this is exactly where it shines. He expertly reads these microscopic signals in real time to make absolutely sure your delicate nerves are perfectly protected throughout the surgery, giving you the highest possible safety margins.
Section 5. Reclaim your mobility today.
The entire process is designed as a completely friction-free concierge experience. You don't even have to leave your living room to get started. You simply upload your existing MRI directly to the clinic's secure portal. From there, you have a virtual consultation with Dr. T to discuss your custom treatment plan. Once you're approved, you fly straight into Phoenix. And because the surgery is so minimally invasive, most patients just recover for a few days out in the warm Arizona sun before flying safely back home with nothing more than a tiny bandage on their back.
I want to leave you with this final, provocative thought today. Your health is your most valuable asset. Waiting in pain is simply a bad investment. Letting a government spreadsheet dictate your quality of life while your muscles atrophy and your daily joy diminishes is a really heavy price to pay. If you have the means, investing in your own health and bypassing that line is absolutely the most empowering decision you can make.
Don't let chronic back pain steal another week of your life. Take control of your recovery today. Call 602-833-2141 to schedule a consultation. Whether you're trapped on a waitlist in Alberta, Manitoba, or anywhere else, your journey back to a pain-free life really does start with one phone call. Call 602-833-2141 to schedule a consultation. Thank you so much for joining me for this explainer. The clock is ticking on your mobility, so the only question left is, will you spend another year waiting, or will you take your life back today?